Bloomberg. Our next witness is Dr. Lynn M. Nichols. Dr. Nichols directs the Health Policy Program at the New American Foundation. This program aims to expand health insurance coverage to all Americans while reining in cost and improving the efficiency of the healthcare system. Prior to joining New America, Dr. Nichols was the Vice President of the Center for Studying Health System Change. Welcome.
Madam Chairwoman Velasquez, Ranking Member Shabbat, distinguished members of the panel, I want to thank you for inviting me to testify here today. My name is Lynn Nichols, and I direct the Health Policy Program at the New America Foundation. I'd like to begin by congratulating Madam Chairwoman for your work on the Choice Act, along with your co-sponsors, first and foremost because it's bipartisan. In my opinion, it is impossible for us to move our healthcare system forward unless we do it on a bipartisan basis. And I think probably you know better than most just how hard that is in this environment. So I applaud you from the outset. Keep up the good work. And I would say I'll take this moment to also congratulate those who've worked on the SHOP Act, another thing added in the same direction, because that, along with choice, adds to a growing chorus that we can indeed do better as a nation in our health reform conversations than we managed to in 93, 94 when I got all this gray in my beard. And Linda and I got tired of walking the halls of OMB. We can do better, and I thank you for that. In your letter to testify, you asked me to think about the question, how can we structure a system to work better for small businesses? And I would say my primary answer is we can help small employers in the same way we can help all Americans. And there really are two big steps, some of which you've taken in your bill. The first is to create an insurance marketplace that is fair, efficient, and fundamentally accessible. And the second is to reform the delivery system so that we can get more value for all our premium healthcare dollars. If we don't do that, it sort of doesn't matter what we do about financing. Now, the first step is to create a new marketplace that's accessible. And this requires, as your bill does, that insurers be required to sell to all customers regardless of health status. There is no question that this is a problem in the individual market at the moment. And in the individual market at the moment, of course, we have a lot of entrepreneurs. We have self-employed people, sole proprietors, and workers who work for firms who can't afford to offer right now. So I think it's important to think about extending that guarantee beyond the small group market to the individual market. But just accessibility is not enough, in my view. We must also make it fair and affordable. So you have to have rules about what you're going to charge people so you don't distinguish people's rates by their health status. Now, I would quibble just a bit with the particulars of the Choice Act in the following way. It is designed, of course, to subsidize employers, and I'm not opposed to that. But a lot of analytic work has been done, some of which with myself and smarter colleagues, to say that we can often get more efficient subsidy schemes if we direct them at individuals. And the main reason for that is that it's impossible for a firm to know the income of a worker. They know the wages. But if you know the income, you can actually tailor subsidies more precisely to low-income families, and you get more bang for your buck that way. So I would ask you to consider those kind of modifications, which we can talk about offline. But even more than target efficiency, one of the reasons I'm a little nervous about moving toward subsidizing employers is because when I look at the 21st century economy and I see the needs of competing around the world, I see a healthcare system here that's more inefficient than others in the world, and we rely more on employer financing. So to move in the direction of trying to expand employer financing, even as we're trying to maintain middle-class, high-value-added jobs, competing against companies who come from countries with far more efficient health systems that don't rely on employer financing as much, it puts a burden on us that we may want to seriously reconsider going forward. Now, as you know quite well, and what impresses me about your act is you clearly recognize this, in order to make insurance markets work better, we have to reorient incentives. And reorienting incentives really means changing what we reward insurers for doing. At the moment, our insurance markets reward risk selection. That is to say, selling to the healthy, excluding the sick any way you can. One important component that can change those incentives is an individual purchase requirement, so that every person is required to buy whatever insurance they have access to. You have to subsidize them for sure. But if you do that, then you take away the incentive to aggressively underwrite and exclude the sick. Then you make an insurance market where you can only make money by delivering value for dollar and having better health services and better insurance bargains. So I think you want to think about adding that as well. As I said, the Choice Act succeeds in creating a marketplace that would work better than the market does now, and I applaud you for that. I do think we can improve going forward. Let me just say a minute about delivery system reform, if I could. No health reform proposal of any form is going to sustain an improvement in our healthcare system unless we bend the cost curve, unless we get serious about delivery system reform. Just because you're a small business committee doesn't mean you can't take this on. Indeed, you do in this act by requiring employers to offer wellness programs, which would, in order to be eligible for the small business tax credit, or As you clearly know, wellness and disease management programs have had great success and have given value to workers and their firms. That's one type of innovation that can help transform the system. Others you might consider include incentives for having enrollees sign up for health homes or medical homes where they have a primary care provider completely oriented toward helping them navigate the system. And also you might consider incentives for providers who adopt electronic records and decision support tools. Small employers will always hold a major role in our conversations about healthcare reform because no single group is more important to our economy and to our society. Small group insurance markets have been the focus of repeated policy interventions since even before Stuart and I started this a long time ago. And employers have suffered from high administrative loads, lack of competition, and I would say increasingly intense competition from firms from overseas. Thus, it is clear that health reforms focused on increasing access to quality, affordable health care for small employers could serve as an important and catalytic step toward the changes we need nationwide. As you contemplate this, I encourage you to think about building a marketplace that can eventually welcome all Americans, not just small employers, so that we can improve value for dollar. Thank you very much.
Thank you.